Hello everyone, I'm Anas Al Ubaidi, and this session or this lecture is about Advanced Emergency Medicine Scribe Review, and it is within chapter 25. And the chapter is about review of emergency and urgent care scribing within and this chapter and this session within this chapter of 25 is within the Certified Medical Administrative Assistant Program by ACMSO. Introduction. The role of an advanced emergency medicine scribe is pivotal in the high-pressure environment of emergency departments, EDS, for short, or emergency rooms, ERS. Emergency medicine scribes serve as vital extensions of healthcare teams, ensuring seamless documentation, accurate record keeping, and effective communication, all essential for the rapid and precise delivery of care. These professionals are not just data entry specialists, they are experts in interpreting complex medical narratives and transcribing them into organized, actionable charts that support clinical decision making. Emergency medicine is unique for its fast pace, unpredictable patient volumes, and variety of cases, ranging from minor injuries to critical, life threatening conditions. This diversity demands that scribes possess not only a thorough understanding of medical terminology, but also the ability to adapt quickly to dynamic scenarios. Every second in an ED emergency department matters, and advanced scribes provide critical support by freeing physicians to focus more on patient care rather than administrative tasks. Advanced level competency in medical scribing for emergency medicine involves mastery of real time charting during patient encounters, adherence to compliance standards, and familiarity with the clinical workflows. Scribes must accurately record patient histories, vital signs, physical exam findings, and follow up instructions while also integrating diagnostic results such as imaging reports and lab values into the records. Additionally, scribes play a key role in coordinated communication, ensuring that all team members and support staff have access to updated and precise medical information. Students aspiring to excel as emergency medicine scribes must focus on developing advanced skills in multitasking, technical documentation, and teamwork. The challenges of emergency medicine also require scribes to maintain composure, prioritize tasks, and stay detail oriented, all while adapting to the physician's work style and documenting medical information under time constraints. Key points. Real time documentation. The importance of real time charting, as real time documentation is a core responsibility of advanced emergency medical scribes. Scribes must record patient encounters as they happen, capturing key details such as chief complaints, history of present illness, HPI, review of systems ROS, physical examination findings, and treatment plans. This practice ensures that clinicians or physicians' notes are accurate and that administrative tasks do not interfere with clinical care. Example, for instance, for a patient presenting with chest pain, a scribe must capture the exact timing of symptom onset, location, quality, and associated symptoms, as for example, shortness of breath, dyspnea. This data is critical for immediate diagnostic decisions such as ordering an EKG or ECG and or cardiac enzymes. And here is a summarized diagram summarizing the components of effective real-time documentation: treatment plans, chief complaints, history of present illness, review of systems, physical examination findings. Efficiency in fast-paced scenarios. Emergency departments, EDs, operate under tight time constraints. Scribes need to multitask, documenting while listening, synthesizing information, and preparing templates for the next step in patient care. Streamlined documentation supports continuity, especially during shift changes or when multiple providers or clinicians are involved. Example, for instance, here, when a trauma victim is brought in, the scribe documents resuscitation efforts, for example, airway management, IV intravenous fluid administration, in real time. This measures ensures this ensures that the medical chart reflects the care timeline accurately and precisely. Here is a summarized diagram on unpacking the role of scribes in emergency care, scribe responsibilities, real-time documentation, information synthesis, and template preparation. Communication and team coordination. Liaising among healthcare providers or healthcare clinicians, scribes serve as central communication hubs between physicians, nurses, and ancillary staff. While the physician prioritizes patient care, the scribe ensures that information is disseminated clearly, particularly for time sensitive updates such as lab results or imaging findings. Example, if critical lab values like dangerously low potassium levels are flagged, the scribe notes them in the chart and informs the nurse or physician immediately to initiate appropriate interventions. Adapting to provider work styles, every clinician must have a unique workflow and set of practices. Advanced scribes must quickly adapt to their assigned providers' preferences while maintaining consistency in documentation style. Effective communication ensures all parties are on the same page regarding patient management. Example, some physicians may prefer concise notes while others may request detailed narratives. The scribe's flexibility improves operational harmony and reduces documentation discrepancies. Compliance and legal considerations. Adherence to documentation standards, an essential part of an advanced medical scribe's responsibilities, is ensuring that all notes comply with regulatory and legal documentation standards such as HIPAA, health insurance portability, and um, regulatory Health Insurance Portability and Accountability Act, short for HIPAA, as HIPAA is short for it, and payer-specific billing requirements. Non-compliance can result in legal liabilities or reimbursement denials. Example, when documenting a laceration repair, the scribe includes the injury's size, location, and complexity, ensuring that the chart supports appropriate billing. Addressing medical necessity, scribes must understand how to justify medical necessity in documentation. This ensures a smooth payer reimbursements and reduces denials. Every patient's encounter should detail why specific procedures or treatments were warranted. Example, for a patient in respiratory distress receiving nebulizer therapy, the scribe documents the presence of wheezing and oxygen saturation levels to support the need for the intervention. Diagnostic result integration, interpreting and incorporating findings. Advanced scribes are tasked with quickly integrating diagnostic results into patient charts. While they do not interpret medical results themselves, they must proficiently transcribe findings to ensure accuracy and relevance. Example, a positive chest X-ray for pneumonia requires the scribe to record specifics such as the presence of infiltrates on the right lower lobe alongside the initiation of antibiotic therapy per physician or clinician orders, updating and revising real-time information. Patient cases in emergency medicine frequently involve as new diagnostic information emerges. Scribes must update charts immediately to reflect these changes, reducing gaps in communication and documentation. Example, for a patient initially suspected of sepsis, additional lab results might point to pancreatitis. The scribe adjusts the HPA, history of present illness, assessments and treatment plans accordingly to reflect the new working diagnosis. Skills for professional mastery, multitasking, and attention to detail. Scribes must juggle between multiple streams of inputs simultaneously, listening, charting, and preparing for the next patient encounter, maintaining precision without sacrificing speed is a critical skill. Example, for instance, while documenting a physical exam, a scribe may also prepare orders for imaging, ensuring they align with the physician's or clinician's verbal instructions. Handling high stress scenarios. Emergency medicine often deals with unpredictable situations. Advanced scribes must remain composed, process information quickly, and ensure all steps are accurately recorded even under pressure. The example here, during a cardiac arrest, the scribe documents the timeline of CPR efforts, defibrillation, and medication administration while ensuring the chart adheres to protocol standards. Continuous learning here, advanced scribes are lifelong learners, staying updated on medical terminology, evolving treatment protocols, and electronic health records EHR technologies is essential for career advancement. Example here, a seasoned scribe may attend training on interpreting point of care ultrasound, POCUS, point of care ultrasound, POCUS, findings to improve their ability to document advanced diagnostics accurately. Summary tables next. Table on real-time documentation in emergency medicine element description example importance consequence of error. Elements we have chief complaint history of present illness HPI review of systems ROS physical exam findings and final note revisions. Table on communication and team coordination communication area role example benefit challenge. Communication areas we have information relay team note coordination, physician preferences, chart handoffs to next shift, inclusion of diagnostic results. Table on compliance and legal documentation, compliance area requirement, example, benefit, non-compliance risk. Compliance areas, we have HIPAA compliance, documentation standards, medical necessity, accurate time stamps, incident log or incident logs. Table on integration of diagnostic results area, role, example, importance, impact of omissions. Result areas, we have lab results, imaging reports, point of care tests, referral documentation, and revised diagnoses. Table on key attributes of an advanced emergency medicine. Scribe attribute description, example, importance, development, tactics. Attributes, we have multitasking, technical proficiency, medical terminology, adaptability, resilience. Next, we will revise what we have covered through this lecture through some or via some MCQs, multiple choice questions. Question 1. Which of the following best describes the role of real-time documentation in emergency medicine? A. It ensures timely updates to the patient's insurance provider. B. It records patient encounters during or immediately after physician-patient interactions. C. It removes the need for compliance with HIPAA standards. Or D. It prevents the physician from interacting directly with the patient. So the correct answer would be B. It records patient encounters during or immediately after physician-patient interactions, as real-time documentation ensures accuracy and reflects the contemporaneous nature of patient evaluations, which is critical for quality care and healthcare provider efficiency. This process also allows physicians to prioritize patient care over administrative tasks. Question 2. What is the primary responsibility of a scribe when interacting diagnostic test results into a medical record? A. Interpreting lab results to suggest treatment plans. B. Ensuring that the results are accurately transcribed without personal interpretation. C. Comparing the results with those from external specialists. Or D. Delaying chart updates until all test results are finalized. And the answer is B. Ensuring that the results are accurately transcribed without personal interpretation, as scribes are responsible for documenting findings provided by the physician, diagnostic labs, or imaging studies, but they must avoid any form of clinical interpretation. Their role is to ensure that results are recorded precisely to assist in clinical decision making. Question 3. What key strategy should the medical scribe employ to uphold compliance with HIPAA regulations? A. Verifying insurance details for all patients. B. Discussing patient charts only in the presence of the healthcare team. C. Allowing non clinical staff access to sensitive patient information. Or D. Sharing updates about patient cases on unrestricted platforms. Answer is B. Discussing patient charts on the presence of the healthcare team. As HIPAA laws protect patient information from unauthorized access, scribes must avoid discussing sensitive patient information in public or non-secure settings to ensure confidentiality. Question 4. Why is adaptability an important attribute for an advanced emergency medicine scribe? A. To learn multiple medical specialties simultaneously. B. To adjust varying workflows and preferences of different physicians. C. To complete all tasks without team collaboration. Or D. To take on clinical decision-making responsibilities. The answer is B. To adjust to verifying workflows and preferences to different physicians. As every physician has individualized preferences and workflows, adaptability enables scribes to align with these preferences promptly, ensuring seamless documentation and collaboration in high pressure emergency settings. So, answer is B. Question 5. What is the primary purpose of including timestamps in medical documentation? A. To enhance the aesthetic presentation of charts. B. To maintain an organized timeline for medical events and interventions. Or C. To track the scribe's work hours during a shift. Or D. To replace the need for diagnostic accuracy in records. Definitely the answer is B, as to maintain an organized timeline for medical events and interventions, as timestamps accurately reflect when specific events or interventions occur, providing a clear historical record. This is essential for compliance, coordination, and potential legal review. And here we come to the end of this lecture. Thank you very much and goodbye.